The first thing a parent should do with their newborn after birth is skin-to-skin contact. However, many moms report not holding their newborn within 5 minutes of birth, whereas the CDC recommends at least 60 minutes of uninterrupted skin-to-skin contact. And in preparation for my second daughter, I read a bunch of evidence-based articles and wanted to share with you my findings. So I summarized Dr. DeFrank's article linked below into describing 5 benefits of skin-to-skin contact immediately after birth. First, when a baby is born, they enter a completely different environment, full of harsh lights, loud noise, and cold air, which engages a defense mechanism called the fight or flight response. And we strive to teach our children how to self-modulate or self-soothe to eventually enter a rest and digest state. And it was found that immediate skin-to-skin contact helps a newborn shift from the fight or flight to a rest and digest state and all the benefits that come along with it. Second, an immediate concern after birth is the ability for a newborn to breathe. And when positioned on their tummy during skin-to-skin contact, a newborn's lung efficiency improves to transfer oxygen from the air into their body, reducing the development of apnea, respiratory stress syndrome, and sudden oxygen desaturation. Third, immediate skin-to-skin helps produce oxytocin. This hormone helps the initial letdown of breast milk and thus sets a foundation of successful breastfeeding. It assists with the recovery from pregnancy by loosening the placenta and contracting the uterus. It even contains antidepressant, anti-anxiety, and properties to help reduce blood pressure. And let's face it, these are all qualities that help us to transition to a life with a newborn. Fourth, immediate skin-to-skin helps to reduce a baby's sensitivity to pain and stress by decreasing the hypothalamic and pituitary response, which can be especially useful for babies being admitted to the NICU, where it's been reported that babies may receive up to 43 procedures daily. This includes things like stressful temperature checks or heel pricks to monitor blood sugars. And lastly, for my fellow dads out there, immediate skin-to-skin contact with us not only strengthens our bond with our baby, but also helps them to develop a healthy microbiome, or gut for lack of better terms, to digest food easier, protect against harmful bacteria, and produce vitamins for health. So make sure to have a discussion with your OBGYN, midwife, or doula to include skin-to-skin contact immediately after birth. And if you notice that your baby was born with a preference to look one way, then check out my video right up here. Otherwise, I'm Dr. Tim, pediatric physical therapist, and thank you for watching my video. Make sure to hit the subscribe button to stay tuned to Tummy Times Academy video next week.